Hello, everyone. Good afternoon. Nice to have you on board. Okay. Um, I would like to see our comments as we go on. Kindly comment your name and where you're joining in from. Kindly comment your name and where you're joining in from. Awesome. Okay, today we're discussing something very interesting. Are you all ready? We're discussing something very interesting, something that is very essential for our growth. For many of us who are seeking for jobs, how to transition into the healthcare industry, how to use the care opportunity as a leverage to relocate from wherever you are to another country. Yes, that's what we'll be discussing today. I'll be going through all of the process. Securing a caregiver job in 6 months. I'm sure that it sounds impossible, but yes, I'm here to tell you it's very possible. In 6 months, you can actually land your dream job in care as a caregiver. Okay, yeah, so without further ado, without wasting our time, because I understand that many of us stopped whatever we're doing to join in this afternoon. So I would not want to waste time too much. If you're just joining in, kindly drop your name and where you're joining in from. We would appreciate that. We'd love to see it. Like I said earlier, we are discussing securing a caregiver job in 6 months, exploring the healthcare opportunities, basically. My name is Esan Labisi. Yes, I'm going to introduce myself very briefly before we go through the slides that I've prepared for us and to discuss. Please, if you have any questions in the course of this webinar, kindly drop your question in the comment section and I'll get to it as soon as I am done. Okay, great. So, like I said, my name is Esan Labisi, and I'm the MD of MedBody Academy, basically. I've gained over 10 years experience in the healthcare sector, and it cuts across, even caregiver opportunities, home care nurse, nursing research, and a host of others. So, whatever I'm discussing with you today is what has been proven, what has stood the test of time, and you can also use it, leverage on it, to gain access into the caregiver route. All right, very quick, very good. Yes, so very quickly, let's go into our slides. Like I said earlier, I'm the MD of MedBody Academy, and what do we do at MedBody Academy? Basically, we specialize in equipping our students with the necessary skills and expertise that is needed to close the gap in the healthcare sector, basically, and we do that because of the increasing demand for healthcare professionals. We are committed to empowering healthcare professionals through education and training, to new heights through innovative and results driven strategies. Having trained over 1,800 students with more in the pipeline, we are your preferred training academy for any healthcare training whatsoever that you may do. But today I'll be taking us through the caregiver opportunity, and which is also called the healthcare assistant. Many times you must have probably heard different names. I've heard people call this old terrain different names, but I'm here to break down all of the rumors, give you the truth, let you know how it works, and I just want you to follow along as we go through this. Yes. Okay, so the healthcare industry, I want to give us an overview very quickly. So, the healthcare industry offers a wide range of career opportunities for individuals without a medical degree. So, whether you're here and you're contemplating, oh, but I did banking and finance, oh, maybe I'm just a poet, oh, maybe I'm this, no, you have no problem at all. At MedBody Academy, one thing we have done is to start basically from the scratch. So if you don't have a prior medical knowledge, if you have never done anything else, you are in the right place because we have dedicated tutors who will take you through this journey. So with the rising demand for healthcare services, there is a growing need for professionals in both clinical and non-clinical roles, many of which require only certifications, training programs, or associate degrees. At MedBody Academy, we're committed to health education, which is the core of your transition into the healthcare industry through our comprehensive curriculum, our hands-on practical hands-on practical, our career goals and internship opportunities, webinars, support groups, and more. Many healthcare careers only require short-term training programs or certifications. Many of us have heard several information online, and sometimes it just seems really difficult for us to navigate or go through this pathway. I'm here to debunk all of that, like I said earlier. With just 3 months or even 6 month training, you can actually get yourself the certification that you need to explore this pathway and get a job. I mean, anywhere in the world where you're searching for a job, we all have our different preferences. And much later in the course of our training, we're also going to go through the available countries, the different pathways that we can use to ensure that we get our dream job. And one thing I'm also going to say to you, which is an addition, is that the healthcare pathway, it's a very lucrative pathway. What that means is that you stand a chance of living a very comfortable and a fulfilled life just by taking the training and securing a job for yourself. I want us to understand that it's important that we build skills. Many of us have focused over time on having training, building certifications, and all of that. I mean, while that is great, if you don't build the needed skills, at the end of the day, you will not be a perfect fit, for employers. So I'm going to let us know the skills, the things that employers are looking for and how we need to, get ourselves prepared for these opportunities. So I'm painting a picture of the healthcare career here. I mean, for many of us who are basically just transitioning to the healthcare industry, there's a number of courses that you can do, that to help you just gain access into it. And some of it is you can decide to be a first aider, you can do medical records and billing, you can do physical therapies, you can do phlebotomist, you can do healthcare assistant. But I want us to look at this diagram very well, and we'll see that the healthcare assistant has a bigger circle. Because as an healthcare assistant, quickly before I go on, let me say that I'm going to be using caregiver, healthcare assistant, health aid interchangeably. Like I said, we've heard different names, and sometimes it can be very confusing. They all mean the same thing. You will hear nursing assistant, caregiver, care aid, home care aid, healthcare assistant. They are all the same thing. So you have nothing to worry about at all. So if you look through this diagram, you see that the healthcare assistant actually has a bigger circle. What that means is there are more opportunities if you take on the course as of the healthcare, if you take on the healthcare assistant course, phlebotomists, physical therapists, medical record and billing first aider are equally great. I mean, they are equally great, but you must understand that you are looking at what would serve you, a bigger purpose. What's that thing that would make you gain jobs, gain experience, able to navigate or climb, the healthcare career ladder. The course is the healthcare assistant course, which is one of the things that we major in at MedBody Academy. I mean, I'm still going to get into all of this, so that we understand properly how to apply for this training, how to go ahead with this training, the skills we need to build, like I said earlier, and the opportunities that lies ahead of us. I hope we are still here. Please, I would love to see your comments if you're still here so I can know you're with us. So, who is a healthcare assistant or a caregiver? I mean, you must have heard this, all of that. I mean, I don't want us to just focus on the slides alone. As you're focusing on that, I would want you to also listen to me, because I will be telling us a lot. And like I said, I've come to actually tell us the truth that lies in this and to debunk the rumors and the lies. I mean, several people have sold different things and they've given different. Many of us are even suffering from, information overload because we've heard so many things. What's the real truth behind being a healthcare assistant? How can you use this to secure international opportunities or maybe even local opportunities? A caregiver basically is someone who renders care, like the word says. An healthcare assistant, someone who assists in the healthcare sector. As the word sounds, that's how simple it is. You don't need to fill up yourself. That's the essence of the training. When you get into the training, you understand better the roles, the functions, and all of that. But for now, just understand that as a caregiver, you'll be doing what? You'll be administering care, basically. And as a caregiver, it's expected that you are trained to actually administer this care. You're not just administering care because you watched somebody do it or because you read few things. No, it's important important that you go through the training, because in the healthcare sector, you're basically dealing with life. Any little mistake could cost so much. And that's why it's important to invest in a training that is worthwhile. And that's exactly what MedBody Academy offers you, where you have access to, I mean, training. We're still going to talk about the benefits, that MedBody Academy is giving to us. But it's important that we attend authentic training that actually build us up to have the skills needed to administer care to either the ailing ones, the old ones, the disabled, people who are immobile, and the rest of it. Also, please just give me a moment. I'm trying to share my screen. All right. Um, also, what are the things that is expected of the care assistant to do? Like I said, you're a caregiver, you're supposed to administer care, and care cuts across different factors. For example, your client or your patient cannot move, you should be able to do that. Your clients cannot feed themselves, you should be able to do that. So the role actually is very encompassing, and that's why you need the training to help you secure the job. All right. Are we still here? Are we still here? Hope you're listening. All right. Okay. So, what are the qualifications and what are the specialty that we have in the healthcare sector? If some of us can mention this thing, what qualification do you think you need, to succeed in this career, in this caregiver pathway? What are the things that you need to have? I would appreciate if I can see our responses, if I can see our comments. Okay, so sorry, I was trying to handle some technical um, difficulties. Yes, I hope you're still here with me. Okay. Also, it's very important that before you go into the caregiver sector, you identify the specialty that is available. Do you want to deal with special needs? Do you prefer the old ones, which is also called geriatrics? Do you prefer to deal with people who are immobile or people who are disabled and all of that? So it's important to identify this thing. And that's why before you even take on the training, it's important to search, also know your skills and your strengths. And this is one of the things that will also happen in the course of the training. And we have dedicated tutors who would support you, who will serve like course advisors, that would support you on making the best decision, even as you transition and make that decision, to decide what specialty, that you would like to explore. So what are there really demands in the world for this. I mean, you must have seen a lot of people saying, come for caregiver training, come for the healthcare assistant training, come and do this, come and do. Are there actually demands? Yes, I am glad to tell you that there are demands in the healthcare sector. The healthcare sector is such a pivotal place to build skill because why? Constantly there is a shortage or there is a need, there is a demand that needs to be met with. People are transitioning from maybe clinical roles to non-clinical roles. Also, we have people retiring and all of that. So there's a number of reasons why the demands are high. For example, aging population. People are not getting younger by the day. I mean, they're getting older by the day. And let's say in the next 2 to 3 years, you will see that you have even more aged population than we have of younger population. So we need somebody to meet the needs of this aged population because at that age, they can't do so many things for themselves. Also, it's very cost effective. And ACA is, I mean, very, very cost effective. You won't place them on the same financial scheme as maybe a doctor or even a registered nurse, which means that you can work with two HCAs or even one HCAs and save, I mean, a very large amount of money because there's division of labor, they are readily available and all of that. Also, increased chronic illnesses. I mean, people are getting sicker by the day. In fact, you hear new diagnoses, new disease conditions. As much as research are going on, for example, let's use cancer, for example, research are going on cancer, but that has not stopped the spread of cancer. In fact, these days we have cancer of several organs than we normally used to have before now. Also, we focus on patient-centered care. You know, a patient needs to be given holistic care, which means that it must cover all rounder. But when you have limited or maybe the workforce, there's a shortage. A patient don't get like a centered care. But with the advent of ACAs, or with the development of ACAs being adopted into the hospital or the healthcare system, you can have an holistic care for a patient because it means that the number of people who are working, who can monitor the patient vital signs, who can assist the patient and all of that is increased basically. Also, are we still here? I would love to see our comment. Okay, also there are diverse career opportunities available. As an ACA, you can progress, into becoming a certified registered nurse. You can become a phlebotomist. You can become a medical record officer. I mean, the ACA just gives you like the foundation, and then you can build your career ladder or your career journey upon it. Yesterday, I was still seeing a video of a lady who lives in Manchester, UK, with her family, and when she left Nigeria, she left as a healthcare assistant. She was working as a caregiver, working for in patient homes. She goes to patient homes in the morning and then till evening and all of that. And just yesterday, I saw her announcing that, oh, she's now in the nursing school and she's currently having an internship in an hospital as a student nurse. That's the opportunity that you get, when you take the healthcare assistant course. And at MedBody, we've prepared such a comprehensive curriculum that covers many of these things so that by the time you're transitioning into another field, you are transitioning with ease. I mean, very swiftly. It's easy. It's very swift, I mean, for you to transition into it because we've given you the foundation and we've started from the scratch already. Also, there's job security and stability. There is job security. I can promise you that. I can guarantee you that because I mean the hospital is an ever busy place. Let's give for example in 2020 when there was coronavirus COVID-19, we saw how much the healthcare sector became really really constricted because I mean the demand or the number of healthcare professionals that were available did not meet the need of the patients that were coming in. So it's important that you understand this, that your job is stable. I mean, for many people who have worked in different places, you know that many times layoff happen, different issues happen, but in the healthcare sector, that's very, very slim, except in grievous circumstances. So you can bet on it that your job is secured and very stable. Excuse me. Also, competitive salaries and benefits. I dare to say, in the world, the highest paid people are usually the healthcare officers. Because why? They literally put their life on the line for other lives, basically. So they are heavily rewarded and compensated. And this is one of the reasons why you should consider transitioning into the healthcare industry. Also, fulfillment and impact. Imagine a patient came in, they were gasping for breath, they were almost at the verge of dying, and just you being there, monitoring their vital signs, assisting, and that patient was able to regain a sense of independence and all of that. I mean, it brings so much joy, to your face. I mean, I've handled so much of a patient that I have seen some patients, go from worse to better, and it just brought me so much fulfillment. That thing of going back home and you're just glad that all your patients are doing well. So there's a sense of fulfillment. Also, flexibility and career growth, because many times in the healthcare sector you run on shift, so a lot of times you can even be advancing in your career goals. That means you can register as a student nurse while you are still even working as a carer. So it's very flexible. On your off days, you can make it up to campus for classes, you can take online classes and all of that. So there's flexibility for you to even grow, even as you're taking the healthcare job. Okay, so what are the steps? How do you go about this thing? The first thing is to research. I said this earlier. What specialty would you like to go into? The job that you even want. What qualification are they seeking for? Are they saying, "Oh, you have to be a healthcare assistant for 6 months before you can apply"? You have to make your research. You have to know what exactly you're doing and how you want to go into this. Secondly, you have to enroll in training, and that's when Medbody Academy comes in. I've said this over and over that Medbody Academy is the perfect fit for your healthcare training programs. And I can promise you that if you go through our socials, even our website, you would see a number of testimonials from our past students, some of which are already working internationally. And for those who are even working locally, they are also doing amazingly well. So it's important that you enroll in a healthcare training program that is sustainable, that is suitable for what you want to do, and that also gives you value for your money. And that's what Medbody Academy does. Also, network. You have to connect with other healthcare people. We're still going to talk better on this. I mean, in our other slides. And then you also volunteer. One thing about the healthcare sector is learning never ends. Learning never ends. So you need to volunteer to keep on improving yourself, getting better, and all of that. So we'll get it to, I mean, the main point of our topic tonight, this afternoon, on how you can, get a job within a 6 month mark. Just stay with me and please go ahead. All right, so we have some hotspot countries. I mean, if I ask many of us now, where do you want to go to? I'm sure we hear Canada, UK, the US, and all of that. While all of these places are amazing, and I mean, I've listed it here as well. Hotspot countries: we have Canada, we have USA, we have UK, we have Germany, Norway, Japan, and Australia. These are amazing places, very good places for you to be in, for you to practice as a caregiver. But because of the increasing amount of people applying for these roles in these places, many times, chances that you'll be considered can sometimes very slim. Can sometimes very. So, what are the things that you need to do differently? What are the things that you, who is planning on relocating or who is planning on getting a job, in these countries, what are the things that you need to do differently from every other person? Number one is to build a strong resume and online presence. And we are not just like, I mean, at Medbody Academy, we are not just like any other training program or any other training facility. We basically give you our support. Many people will promise you, over promise you what they cannot even deliver. No, we don't do that here. At the end of your training, we always make sure that there's a package CV template or resume template that we present to our students so that you can build your CV to international standard. You make sure that you build your CV to international standard. And that means that you can apply for job in Canada, you can apply for job in many of these places, basically. Because if you are using, for example, let's even break it down a bit further. For your resume, for example, let me even, well, many of us are familiar with CV. It should not contain unnecessary details. It should contain details that your employer needs, to make sure to figure out or to determine that you're a great fit, for the job. Basically, your name, your contact number, even address, you just keep it very simple. Don't overburden the lines with too much information. Just keep your address very simple. Let me give, for example, maybe you stay in Ikeja, Lagos. Just put Ikeja, Lagos, Nigeria, basically, and then your contact number. Usually, on a plus, I advise that you use two contact numbers so that when they are reaching you, and I mean, we can tell how network can sometimes be very, very terrible. When they try on the first one and then it's not going to, they can always try on the second one. So I usually advise that. Also, you need to highlight the training and the certifications that you have. If they gave you, if you were giving maybe 10 certificates, you have to highlight it here. And that's a plus for us at Medbody Academy, because currently we give 18 certifications to our students, the healthcare assistant certificate and 17 other certificates that cut across essential skills in healthcare. For example, first aid, you don't need to take a first aid course again, because in the course of your training, we'll provide that with you. We give medication regulation, we give fundamentals of mental health and psychological care, we give dementia care. I mean, we give a number of the certificates. So you will not, a lot of times, some people take the healthcare assistant certificate and they start taking other smaller and short courses. No, in the course of your training, we have built a system, that gives you the ability, to do all of these courses. We've created our schedule and our curriculum to adopt all of these courses. And then in the course of your training, you take them. And at the end of your training, you take assessments, exams, and you earn the certificate. So I mean, 18 certificates is a whole lot. It gives you a leverage. It puts you forward against the rest of the candidates applying. So just by having that 18 certificate, you have proven to your employer that you know what you're doing. You are, I mean, you have such a broad network of certificates of things that you know, basically, and it just sets you apart from the rest. You become very distinct. I mean, if I was applying for a role and I'm presenting, oh, I have this, I have that, I have this, I have that, and they are testing me through all of these things, and they find me worthy of that job. I mean, you are just you know that I want to liken it to a princess feeling. It just makes you feel elated and on top of the world. And that's exactly what we do to our students at Medbody Academy. We want to make sure that they are distinct, they are different from every other person. Also, include relevant experiences that are relevant to the role that you're applying. For example, you're applying as a caregiver. For example, I don't expect you to write, I have baking skills, because at that point it doesn't align. So write skills like I have built a teamwork and collaboration, patience, transparency, professionalism, accountability. These are the things that your employers want to hear. I want to sit in the position of an employer now, and I want you to sell maybe what you have and sell it to me. I mean, I'll be looking out for skills that align with the job role. I won't just want to hear you say anything. I mean, you can have experience as a baker, beautiful. You can have experience as maybe a seamstress. All of that is amazing. But at that point, I want to see the skills that you have that align with that job that you're applying for. I hope you understand, and I hope you're still here with me. Please drop your questions in the comment box. Any further comments, maybe additions, you can also drop it there. I would love to read from you. Also, list out the skills, like I said earlier. Don't just say, oh, I'm patient. List out the skills that you have. For example, if you know how to use EHR, which is electronic health records, write it there. Let them know, because by the time they are employing you, you are already making the job easier for yourself, because they don't need to start training you from the scratch already. Because why? You already have these skills and they are ready made for you to just enter into the healthcare sector and begin to learn and begin to practice while learning as well. Okay, so you also need to build an online presence. Many of us are seeking for jobs, and we have profiles on Indeed, on LinkedIn, and they don't even look like the job that we're applying for. No, you need to constantly put yourself forward and push yourself out there. You need to push yourself forward. You need to Talk about what you do. Every time you make a post, remind them I'm a healthcare assistant. This is what I do. I'm a caregiver. Connect with people in that network as well. Connect with people who are healthcare assistants, because even as healthcare assistant, there are cadres. We have senior healthcare assistant, we have junior healthcare assistant, we have trainee healthcare assistant. So there are cadres as well. So you want to learn from people who are ahead of you already, and you give yourself a stronger chance of, getting that job. Also, you need to also know where to apply for caregiver job. For example, if you're applying for caregiver job, internationally, there are certain sites where you would easily get these jobs, where you know that these jobs will be listed. For example, if you go to the NHS, which is the UK healthcare system, they many times they have different listings of job. Then when you go to Indeed too, you can see some of these jobs. So know the right site, know the right place to seek for this job, or to check for job application. And another beautiful thing, I know that it was a you may be wondering, oh, who is MedBody Academy exactly? We're an angel, we're a trusted partner in the healthcare training program, because we, at the end of your training, we also give available link to job sites. So, which means that we'll give you this link, and all you need to do is just apply step by step. And with all of the other things that I've said, you stand yourself a chance of getting a well paying job, basically. Also, you want to, having built a network of healthcare healthcare people in the healthcare sector, so to speak, you can also speak to them. You can directly contact them and tell them, this is what I do. And if they have spaces in their organization, in their facilities, they can always consider you. So always speak up, talk about what you do all the time. And also volunteer. In the place of volunteering, you meet people, and then you can also discuss with them, and before you know it, you can find an opportunity that is exciting. And just beyond even finding an opportunity, volunteering also makes you do what? Learn better. And at Maybody Academy, this is something that we totally approve of. After your training, we provide internship opportunities for our clients, for our students, so that they can have a real life experience. And this even gives them an edge, because sometimes an employer wants to also know, have you even had a real life experience at these things? Have you done something around these things? Is it something that you can do? Will you scream at the sight of blood? All of those things. But if you already have a real life experience, and you have letters, or reference letters, or even other things to validate that particular thing, you stand a chance of getting this job. And there are numerous places where, as a caregiver, you can work. I know that over time, many of us have limited ourselves to the hospitals, which is great, by the way. But beyond the hospitals, you can work in as a home care aide, which means you can work directly in the homes of your clients. Basically, you can work in hospice. Hospice is like a private hospital system, where people who are probably in their dying age and all of that, people who are already getting to the end of life, that's where they are. So hospice care is more like palliative care. It means you just try and ease their pain and make them comfortable. You can't really do anything about their medical condition, but you just make sure that their last days are with ease, and with comfort, basically, with family as well. So you can work in orphanages, you can work in refugee camps, you can work in what's it called, NGOs that NGOs that support healthcare, the healthcare sector. For example, we have some NGOs, who they look after the welfare of children without motherless children, so to speak. Yeah, so you can work in NGOs, you can work in refugee camp, you can work with first aid, because you get a certificate as a first aider. So you can work with Red Cross Society. The list is endless, and that's why when I was talking about how we transition, one of the first things you need to do is research, ask questions. You can always walk into our facility, made by the academy. You can always walk in to ask questions and discuss some of these things. You can always reach out, to just discuss some of these things, basically. So what are our offerings at MedBody? I mean, I've said a lot about MedBody. MedBody does this. MedBody. I just want to list it out for us. Number one, we provide you a comprehensive training. This training has been tested and it is sure. So, one, if you take MedBody healthcare assistant training, I promise you that you don't need any other thing. It's all encompassing. We provide you everything that you need to stand out as a healthcare assistant. Also, we provide hands-on practicals. It means that you can come here, have your practical done, with our mannequins. The tutor takes you through all of the practical sessions. We have practical videos that we give you access to watch, and see how some of these things are done. Also, internship opportunities. Once you're done with your training and your practical with us, we post you to our partner hospitals and care home for internship opportunities. And I mean, I mentioned that earlier, so that we can have real life experiences. Then we give available link to job sites. I mean, so you don't even need to go merry. You don't need to do the whole merry go around the internet. We give you available link to job sites. Just position yourself in a way that employers will be able, to give you that dream job. Also, we provide CV templates to help you build your CV up to international standard. We also provide interview prep videos. So there are people who have done these interviews with their employers, and they were able to ace the interview. So we're going to give you some of these prep videos so that you just prepare yourself on some of the questions that will be likely asked. How to be confident when responding, how not to talk too much while also saying what you need to say. We just make sure that you are prepared and ready for this job. Also, we give our support basically across board. We give our support whether you're undergoing the training, or even after you have graduated. Probably you need us to send anything to your employee, whether you need advice, whether you need mentorship, you need guidance. MedBody Academy is available for you. I mean, for you for to answer all your inquiries, all your to clarify every questions that you may have. Our support, transcends beyond the wall of the classroom. It goes even beyond your graduation. We're available for you all through, the process until you get that job. And even when you want to make advancements in your career ladder, we are available, to advise you and give you the needed support as you go. Also, I want to announce something very quickly. For as many of you who are watching this live, I mean, we have a special offer for you. Once you reach out to us or get across to us, just let us know. And we have available, I mean, very, very special offer Apologies for the glitch. It was just a technical thing. We're back. So sorry, apologies. So yes, sir, like I was saying, as soon as you come and join us and you tell us that you came from this webinar, you have watched the webinar, who asked questions, right? You came from the webinar, we have a special offer available for you. So stay tuned. I'll be expecting your messages so that you can enjoy this special offer, basically. All right. So, I mean, I want to quickly talk about before get there. I want to talk about countries. I've told us how to stand out, but I also want to mention this very quickly. While Canada is great, while the UK is amazing, the US is beautiful, Germany is such an amazing country, Australia is great. I mean, there are other smaller countries that we can relocate to, and after 2 or 3 years, I mean, you can easily relocate from that country to, I mean, some of these countries that you really want to go. For example, Luxembourg is such a small country in Europe. You can, I mean, within 4 months, you can easily relocate to Luxembourg by having your certificate. I mean, you would relocate using the skilled workers pathway, and then after getting a job, after like 2 years in Luxembourg, you can easily move to the UK, you can move to Canada, you can even move to the US. I want to also say something very quickly about the United States of America. Is much even after your training to get a caregiver job in the US, you would take their certified exam. I mean, for you to gain access into this country. However, because of our training is already really encompassing, you really do not need so much. You just need to register for the certifying exam, and you are good to go basically. Oh, okay. So another country we have is Malta. Malta is a very small country. I mean, that you can relocate to in a space of 4 months, and you can easily navigate from there. Also, we have Czech Republic. I mean, Czech Republic even allow you come and study right where there. I mean, tuition is free. Tuition is free in Czech Republic, and when you're in Czech Republic, after a while you just easily navigate or relocate to your country of choice. So sometimes you may not start with your country of choice, but just knowing where you should be part-time and already having a well structured approach towards exploring these opportunities or this pathway just give you a very good landing or a very good standing. And when you are in these smaller countries, or even in this another country I didn't even mention is also Dubai. I mean, so when you're in these countries, after a while, you can easily navigate or cross over to your dream country or your country of choice. Also, we must also remember that not all countries support you bringing in your family immediately. Some of them would have you, I mean, for example, let's use Ireland, for example. You have to be in the country for 9 months because before you can file in for family. And that's why the place of research is very, very important. And we are very open at Medbody Academy to guide you and give you the necessary advice, even as you navigate through your career, the career pathway, the career pathway, I mean. So now, for you to enroll, just kindly visit www.medbodyacademy.com. I'm going to take that again. You can visit www.medbodyacademy.com. Please, you can take a screenshot of, I mean, this particular slide, basically, so that you do not forget, or you can pay directly into our Money Point account, which is 6363285105. 63, another 63285105. The name of the account is Tutorial Limited hyphen Medbody Academy. I would stay on this slide for a bit for as many of us who want to take a screenshot or who wants to write down, the account details or our website. I mean, all of these things I've said, some of it you can also go to our website, read some of the testimonials from other students just like you who are also trying to navigate, the carer pathway or the caregiver pathway, so to speak. I mean, you can listen to their testimonials, some of who have gotten jobs, even testimonials on the training in itself. Yes. www.medbody. For many of us who have not taken a screenshot, I'm going to wait a while. Let's take a screenshot of this or write it down. Our website is www. You can see it displayed on the screen, www.medbodyacademy.com, or you pay into our Money Point account number 6363285105. For many of us who may not be in Nigeria, wants to pay in other currencies, right on our website, all you need to do is change it from whatever currency into your preferred currency. We have the dollar account, we have the pounds account. I mean, whatever currency it is that you're using, all you need to do is just go to the currency box and change to your currency, and then you can pay in that currency. I'm sure that by now every one of us have this already. Can, okay, okay. I'm sure that by now we have this already on our phones, or probably we've put them down. It's also on the screen, www.medbodyacademy.com. All right. So, in conclusion, basically, I mean, we've said a lot today. You can actually transition, from being a student to actually working as a caregiver in a space of 6 months. I have given us several examples of countries we can relocate to. I have given us, even steps how to build ourselves to actually get some of these jobs, even the places that we can work. We don't have to limit ourselves to the hospital system alone. We can actually work in diverse places. I mean, we can do amazing things with the certificates that we will earn at MedBody Academy. So MedBody is committed towards enhancing your skills and knowledge. We're here for you. Thank you for listening. So I'm just going to play it back to the account number for as many who are just joining now and probably haven't seen it. Our website and our account number. Our website is www.medbodyacademy.com, or you pay into our bank, our Money Point Bank account, which is 6363285105. 6363285105. The account name is Tutorial Limited Medbody Academy.